One of my biggest dilemma this year has been, if I continue with my job as a broadcaster na hii condition yangu ya masikio nimeisha. But if I stop my job na kale kasaloka na ingia pale kameniweka hii town, nimeisha. So kuendelea umeisha, kuacha pia umeisha. Anyway, first of all, let me say asante. Thank you so much. Because when we posted Hear Me Clearly, we knew very well that I was sharing a very personal side of my life. What we didn't know was the amount of love that was going to come from that piece of testimony. Nimepata simu, nimepata text messages, nimepata comments, watu kwenye DM, nimepigiwa mpaka nchi za nje. A lot of people have shared contacts of doctors, surgeons, wengine mpaka nimetumiwa mapasta na wachungaji. Asante. Thank you so much. Alafu pia kuna watu ambao wameuliza maswali mengi kweli. What exactly is happening? Masikio yako yana shida gani haswa Mwakideu? What is affecting your hearing? Yes, you're talking about 22 years in the industry, the headphones, living loud and stuff. What happened to your ears? What normally actually happens? Ni kitu gani kimekufanya paka uko mahali ambapo you've lost 50% of your hearing kwa sikio lako la kushoto and almost 35% kwa sikio lako la kulia? Ni nini kilifanyika pale? So there's so many questions that have come in. And a lot of other people also who actually have this hearing loss issue, wameni DM, wameshare stories zao. Asanteni sana. Thank you so much. Now, I don't have all the answers, but kwa sababu ya ile impact ambayo hiyo documentary imeleta, nimesema lazima nimregeshe Dr. Hellen kwa Hear Me Clearly Part 2. So ladies and gentlemen, boys and girls, this is your chairman Alex Mwakideu, and seated next to me is Dr. Hellen. Karibu once again.
Asante sana.
Uko fiti?
Niko salama.
Mambo mazuri?
Kabisa.
So first of all, Dr. Hellen, I want to clear the air here. Na nataka uconfirm. Jamani, sikufi. Sifi. Kuna watu asanteni for the love, lakini kuna watu wamepanic sana. Hii documentary ime-create a lot of panic. I want you to confirm my condition na uambie tu watu kwamba niko salama. Yes, it's true that I have lost some amount of hearing. Ni ukweli, hata nikitoa hizi hearing aids right now kidogo na struggle hapa na pale, sio vile nilikuwa naishi kama kitambo, lakini nipo tu sawa jamani.
Yes, asante sana Alex kurudi na at least kujaribu kusaidia Wakenya wengine ku understand exactly what is happening. Yes, you're not dying and it's not the end of the world. The reason why it's not the end of the world is because this is something that is happening and to many people.
Yeah.
Na kuna wale kama wewe ambao wameamua I'm going to do something about it.
Yeah.
So what is happening to you is that you have lost the part of your ear or the hearing cells that actually conduct sound to the brain, send sound electrical impulse to the brain. So ningependa watu waelewe kwamba hearing is not just unaweza kuwa ati you lose your hearing and then something surgery can be done or medication can be given and you're good. So hearing loss can affect different parts of your ear.
All right.
And that is why we have different types and different degrees of hearing loss. So kuna the hearing loss that can affect somebody because ya wax or a tumor in the canal or mtu anaweza kuwa na middle ear infection, ile saa zingine mtu anapata masikio inauma sana na uchafu inatoka usaa, hiyo ni middle ear infection. Kuna saa zingine hiyo middle ear infection inaweza fanya mpaka zile bones ambazo huwa zina conduct sound kwenda kwa the hearing organ ambayo tunaita cochlea, pia nazo zinakuwa damage na erode na huwa haziconduct sauti kwenda kwa hearing organ vizuri. So pia that is another cause. Kuna some other middle ear infections ambazo pia zinahitaji surgery kama ukipoteza eardrum yako ama eardrum ikipata shimo kwa sababu ya infection ama kwa sababu ya trauma, pia inaweza leta hearing loss. Lakini sasa kuna hearing loss kama ile wewe uko nayo. The hearing loss of the inner ear. The one we call sensory neural hearing loss. So sensory neural hearing loss is also again divided into two. So there is where it's the sensory, where it's what we call the hair cells of the hearing organ, the cochlea, that will be temporary and mostly not, I wouldn't say temporary, I will say they are partially lost or they are completely lost, or there's a situation where the nerve itself is actually damaged or it's not working properly or there's a missing nerve, and to some people even those organs are not even there. So for you, it's in your case it's the cells, the hair cells that conduct sound or send sound from the inner ear to the brain that are damaged. They're not totally damaged. That is why you still have hearing. Ukitoa hearing aids zako bado unasikia. Ni vile tu you cannot be able to communicate with like a group of people. You cannot have a conversation with people at a certain distance. It has to be a one-on-one. It has to be 2 or 3 people. In your work line, you have a lot of meetings. You have you go for road shows, and those ones you cannot be able to even hear people because now ile noise ina mask the little sound that you can be able to hear, and so it just makes it very difficult for you to hear. So again, I will say it's something that is manageable. Like now what we have done the hearing aids to amplify sound so that you can be able to hear well, and especially in your case, your choice of the kind of hearing aid you chose, you chose helps you be able to even communicate in very noisy situations. Yes.
All right. There is a question here. My situation at the moment. Is it reversible?
Okay. No. So, I'll start by first stating that the type of hearing loss that you have in the entire world, we have not been able to get anyone who can regenerate those cells. Yes. Research is still ongoing to be able to regenerate the cells of hearing, but at the moment we are not able to. Then I now go to the degree of hearing loss. So we have usually mild, moderate, severe, and profound to people who will call sometimes deaf people. For mild, moderate, severe, and sometimes to severe cases, hearing aids are enough. In a few patients, hearing aids are not enough in that category, but in most of the patients, hearing aids are enough. People are thinking about surgery. We can't repair the cells, as I've said. It's not where the eardrum has a problem. It's not where the middle ear bones are a problem. It's not a problem where there's a tumor in your middle ear. It is just those cells that cannot be regenerated or cannot be brought back. For people who have moderate, severe, or profound hearing loss, depending on so many factors, then we have something called a cochlear implant that can be given to those people who hearing aids are not able to help work for them. All right. Yes. So for your case, no, hearing aids are your best option. Yes.
Now someone else is asking, now that it is not reversible, and they're here and they're working, they're in this industry, places where there's a lot of noise, and they have to do their work every single day. How do you protect your ears in a way that you will not be the next Alex Mwakideu?
That is very good, and it is important that you've actually asked that question, because there are so many of Alex Mwakideus out there. There are so many radio presenters, there are so many DJs, there are so many entertainers.
Yeah.
And so, and not only that, there are so many young, and factories and young people who are using a lot of, or who are exposed to a lot of noise and music. So the best way to protect your ears, first of all, is if you're in the industry, let us get used to wearing ear protection. For people who are working in industries, we have noise plugs.
Okay.
And noise plugs come in different variety, different forms, depending on exactly what kind of work you do.
Okay.
We have total, we have partial, we have customized, so those ones are there for people to use. For people in your industry, it is again...
Hold on, Kidogo.
Yes.
Where do you get them?
So, you can get them from audiology clinics.
Okay.
We have some partial and total ear plugs that you can get in certain pharmacies as well.
Okay.
Yeah, there are certain pharmacies that sell the partial ear blocks.
Okay.
These ones are for people like using matatus. If you want to go to a concert, then you just have something. They have a string, you tie it on your neck. When you get to where you're going, you plug them in, and then you take them out.
Okay.
Like if you're getting into a matatu, just take them out, plug them in, and then alight your matatu.
Okay.
Yes.
When it's too loud.
When it's too loud.
All right. So can you control them? Because sometimes you're probably in a concert, you don't want it to be so noisy, but you still want to hear them.
So that is why I'm saying we have customized.
Okay.
We have customized noise protection.
Okay.
There's certain, there are those ones that reduce noise up to a certain level. So we have 20 decibels, 30 decibels, 45, 50. The maximum is 60 decibel reduction. So for example, if the volume in decibel or intensity, decibel means the intensity in simple language, the volume. If the volume at the concert is like 110 decibel, then if you know that that's the kind of loudness you're exposed to, then we give you a 60 decibel reduction. And so it reduces especially high frequency noise. High frequency noise is the noise or sounds that are high pitch, and usually that is where most of the damage begins.
Okay.
In the high frequency, in the high pitch sounds like S and F and T and X. So, or when it's a siren or some of the ringtones on our phones, they are usually in high pitch. So we want to reduce that. For people working in bands, then they need like musician ear plugs, where it reduces, they're still able to hear their music. But then the volume is reduced. Like if the drum is playing, if the violin is playing, if the trumpet is playing, then they're still able to hear all that.
Okay.
Yeah.
Hellen, one of the biggest problems that I had was I could not tell immediately that I have this issue. How does someone know that I'm losing my ears? I'm losing my hearing. How do you know? At what point should you say, Because by the time I came already, kama ningejua mapema sana, maybe I would not have gotten to where I am today. Maybe, I'm just saying maybe. How do you know? What are some of the things? Because mimi nilikuwa nachukulia tu kama, umesema nini? You know, it's like kawaida, like ongea kwa sauti. So at what point should you say, hapa, maybe there's a problem with my ears?
Yes. Sana sana kwa watu wengi huwa wanaanza na ebu rudia, umesema nini? Alafu your colleagues or people around you, they say, wewe huwa usikii. Mbona kila saa unashinda ukiuliza turudie? Your volume iko too high. Can you reduce the volume? Everybody around you is saying the volume of the TV, the volume of the radio. Even when you're talking on the phone, that we can hear the speaker on the other side. Okay. Also, if you're not able to like have a conversation properly with like a group of people, 3, 4, 5 people,
yeah.
and you have to keep like really looking at their mouths, looking for cues so that you can be able to understand them. There are other signs like even ringing or buzzing in your ear. People think that it's just maybe wax, it's just something. Yes, there are other causes of ringing and buzzing in the ear, but that is one of the causes of hearing loss. So the quickest way people will know that somebody has a problem is that constant asking for repetition. When your spouse or people around them or just your children keep saying, we unisikii, we usikiangi, we uko na select. Unfortunately, they will start saying, uko na selective hearing. Now that is a problem, and it can affect like a relationship, whatever sort of relationship people have.
Like unasikia hii lakini nyingine usikii. Nikikwambia unipeleke out au usikii. Nikikwambia nakuja home hiyo umesikia very fast.
Na ningependa kuemphasize sana kwa sababu najua we are now dealing with you who is an adult, but I would like to emphasize on children. Kuna wale watoto ukiwaita wanaitika, lakini ukiwaambia instructions anafanya opposite. Ama leo umemwongelesha ameelewa, kesho hajaelewa. Especially for children who have partial, like it's not complete total hearing loss. Then those ones are the ones to note. Wengine wanasema huyu mtoto ana kichwa ngumu. Mwalimu anasema huyu mtoto huwa asikii. Mtoto ana kichwa ngumu, unaona leo alinisikia, kesho jana hakunisikia. Yes.
Okay, and they can't speak for themselves.
They can't speak for themselves.
So as a parent lazima pia usikie na ujue hapa kuna shida.
Yes.
All right. Another issue that came after the release of that documentary was the hearing aids. Watu wakasema, hizi za Mwakideu kwani ni gani? You know, maybe for you to explain hearing aids zangu na ziko katika viwango tofauti, ama this is just a very expensive condition that I have now. You know, because watu waliuliza sana historia ya bei na prices pale. Talk about the prices.
So hearing aids come in different forms, different technology levels, different technology, I would say chips. Okay. So first of all, for one to be given a particular hearing aid, there's so many factors that are put into place. Kuna the hearing loss itself, number one. The degree, that is the degree of the hearing loss. So kuna, I will also say about the type, but mostly it's the degree of hearing loss that determines. Kuna zile
so kidogo tu jamani, tuelewane. Ni mahali ambapo umefikia katika masikio yako, yani katika kupoteza kusikia kwako. Kwanza kabisa lazima upimwe. There must be a hearing test. Lazima uangaliwe masikio yako uko level gani. So hearing aids haupewi tu zozote zile. So kuna hearing aids ambazo unapewa kulingana na ulivyoathirika na kusikia kwako, sio? That's very important, by the way.
Haya, sasa kutoka hapo kuna lifestyle yako iko vipi, your age, okay? Age kwa sababu siwezi pea mtoto wa miaka, for example 15 and below, in most cases, not all, but in most cases, the kind of hearing aid style that you have. Okay? So the style matters with the age of the patient or the person. Siwezi pea mtu mzima ambaye akona miaka 80, miaka 70, hata kama the degree of loss ina suit that particular hearing aid. Siwezi mpa that particular hearing aid. Now, when we talk about technology, kuna hearing aids ambazo ni basic. I will use the analogy of a phone. A phone is meant to communicate. In the same sense, hearing aids are meant to make someone hear well. Okay. So in that context, any hearing aid will make, and I mean hearing aid because kuna vituko zingine huku nje. So any hearing aid.
Wacha nikwambie kuhusiana na vituko zingine unazoongelea pale. Now, you see, I have a brother of mine who lives in Europe. Hii shida ilipokuja, especially nilikuwa nikikaa katika meetings. Mimi, my biggest problem was when I'm sitting with a lot of people. Like you're saying, sijui atulini. But anyway, that's why you're Dr. Hellen. Ulikuwa ushajua, sisikii watu wakiongea wengi. So nikasema nika Google, nikatafuta mtandaoni mimi sasa, this is now me working on myself and saying how can I get these things, all right? So I got some and I told my brother to buy them for me, and he bought them and he sent them over, and the next meeting I'm having, I'm so happy. Kazivaa. Hizo vitu zilikuwa zinanipigia kelele kwa masikio. It was yani immediately people watu walianza kuongea na kuclap because you know to succeed kwa hiyo I removed them immediately. It was too much noise. I don't know. I think there's a difference between hearing aids and I think there's something called an amplifier. I don't know. I don't know what I was, because they were not, they were very affordable, extremely affordable. I don't know what they were, but to date bado ziko nyumbani, niliziweka katika drawer na nilisahau hizo story kabisa. So ukisema kuna vituko na kadhalika, I think ile ilikuwa ni moja wapo. So sijawahi kutumia tena. And that's the reason why nikasema sasa wacha nirudi tena OC nipate advice. Alright, endelea.
Kabla niendelee na hiyo technology, kwa hizo vituko ni unapata kuna wale wagonjwa wanavaa hizo amplifiers ama wananunua hearing aids, ndio zinakaa hearing aids kwenye internet but hazikuwa programmed. So unapata either alinunua hizo vitu hazikumsaidia, hazisikii vizuri ama zinapiga makelele, kwa sababu watu huku nje wanasema hearing aids huwa zina damage mtu masikio, hearing aids zinapiga makelele, zina make everything worse. It's because they were not hearing aids. Or if they were hearing aids, they were not fitted by a professional. Okay, because again, hearing aids have to be fitted by somebody who knows what they are doing. And so going back to the technology, kuna hearing aids ambazo tunataka tu conversation. Mtu mzee nyumbani ameretire ama just a lady or a man who doesn't go for meetings, ana watu wa makelele, tunaweza mpa kitu kama hizo, tunaisema entry level ama essential ama basic. Normal conversation, hakuna music, hakuna concert, hakuna meetings. Why do you need something so expensive, so fancy? Okay. Then kuna wale ambao watu wanafanya ofisi, ndio bado hawako exposed kwa makelele but wanaenda meeting. Kuna hizo levels, kuna select ama advance. Sasa pia hiyo inaendana na mfuko wa mtu na but needs zake. Okay. Sababu si ningependa kumpa mtu anaenda ofisi na ana mkutano a basic hearing aid kama anaweza afford an advanced hearing aid. Okay. Because the hearing aid microchip works differently. The microphones work differently. Kuna zile ziko na directionality, kuna zile zina cut out noise, kuna zile zina make sure zina enhance speech. Okay, like kama zako za enhance speech, ku reduce noise, to ensure that you're comfortable in hearing speech in very noisy situations. Okay. Kuna hearing aids ambazo zina change environment by itself. What I mean by that is sign tuko hapa tunaongea, it's a very quiet room. But then you walk out of the street, there's wind noise, there's traffic, there's beba tao, I don't know what. You need to be able to hear all that, but it should not be annoying. And when you're walking with somebody on the road, you should be able to hear that person. When you're in the car and you are with people, the hearing aid, and if that is your need, you should be able to hear the people behind you. If you're a taxi driver, if you're a driver, you should be able to hear people on your side and behind you. Now, there are people like you who are always in busy situations. I cannot be able to give you, especially knowing who you are and what you want, because this, for me to know you, I'll have to ask you so many questions. What do you need? What is your lifestyle like? What would you like to improve in your life? So then we give you that particular technology depending on your needs. Sisemi kwamba this technology ya essential or entry level or basic haifanyi kazi. Inafanya kazi vizuri sana. Kama yule mtu anafanya shooting ya video, kazi yake anataka kushoot videos, anataka good camera, ataenda kwa kabambe ama simu ya 6,000, ataenda kununua sijui iPhone what, sijui Samsung what. That is the kind of difference. And I would like people to understand that yes, your hearing aids were a bit pricey, but it is because of your needs. Yes.
Like right now nimetoka kwa show already ambao tulikuwa tunafanya pipeline. So my morning show 4 hours tulikuwa tuko pipeline. And it was powered by a brand and of course tulikuwa tunaongea na wananchi, and there's music and I have headphones and you see, that is my life. And then after that I get into the car. After getting to the car, I come straight to you, Dr. Hellen, here, where we are in a room now. After here, I'm heading to another wedding, which is happening somewhere in Limuru. So you can see my life. I'm heading to a wedding. I am from Pipeline. Now I'm in a... So as you speak right now, ukiongela kuhusiana na hiyo hearing aids that change according to environment, that is the setup I have at the moment as we speak. So that's the setup I've had since morning. So nikienda Pipeline, hiyo ndio ilikuwa ni setup. Kwa noise, there's a way ina adapt na hiyo mazingira yangu pale. Kiingia kwa gari pale, ina adapt na yale mazingira yangu ya gari. Nikikuja kwako hapa, ina adapt na haya mazingira ya hapa saizi as we speak. When I leave and go to the wedding, bado ina adapt na yale mazingira pale kwa ile wedding, so that I am comfortably talking to everyone without having to worry anymore. Huyu amesema nini, huyu amesema nini, yule umeniita. Yaani maisha yangu yanaendelea kama kawaida. So
kunazo pia nazo hearing aids kama za saa za kisasa, they have AI to learn who is this wearer, who is Alex, how does he speak like, what is the kind of conversations around him, what is the kind of noise or sounds around him, and they adapt. But unaweza pata ndio hearing aids zingine hazina hiyo AI, ama the kind of AI again is not that advanced, because right now we also have the major hearing aid companies wako na something called deep neural network. So the deep neural network or the sphere, or you know, when hearing aids nataka kukulan brain yako huwa ina function vipi. I'm not trying to scare people kwamba ina pick information from your life. No, it's just trying to learn who is this person, how can I make this person's life better, especially when it comes to hearing. Yes.
Wow. There you have it, my friend. This journey is long, and gonna host a lot of people here katika AMTV, and I want to just help you understand and help you protect your ears. I'm a victim. Mimi, lakini usinone huruma. Niko sawa. Niko fiti, by the way. Niko fiti. Life yangu haija change. Niko sawa. Niko much better. Okay, before the hearing aids kidogo but now with these hearing aids I'm okay. Okay, nyumbani wapi kila mali niko tu sawa. But this journey has to continue. And I want to hear from your stories. And I want to hear from you. So engage me katika comment section pale. Let me understand kuna questions zingine uko nazo. Let me understand kama kuna struggles uko nazo. You know, talk to me right now. Let's have this conversation. It's very important. Na kama unafanya kazi, wewe ni mtu wa kelele kama mimi, take care of your ears. There is a way you can take care of your ears. Unaweza kuziprotect ukiingia pale kwenye fujo nyingi. It's important to do that. Just take care of your ears. That's what's up. Unless Hellen uko na kitu kuongezea pale.
Hapo kwa take care of your ears, kama unaweza afford noise cancellation headphones and you must use them, please use them. If you use Bluetooth devices, tafadhali, according to hata World Health Organization inasema safe listening, and so we are advocating for self listening. Nakumbuka kuna watu walisema, so do we throw away our Bluetooth devices, our iPods and our whatevers? No, I will not say it's a yes and no. If you cannot be able to control the amount of volume that you're putting in the sense of the volume is too high, the people around you can hear your music, and you're constantly putting your Bluetooth ear devices in your ear, then the answer is yes. But if you can control the volume, by the time simu inakupea warning, juu umeshafika juu. So you have to go 4 steps down. Listen with the earpods or whatever Bluetooth devices that you have for an hour. Take 2 hours off. Maybe another time use it for another 1 hour. That is really going to help you protect your hearing from noise. Kuna watu pia wanasema but mimi natumia bone conduction. Sound is sound. And the unfortunate thing is bone conduction is going straight on the hearing organ. So ina stimulate hizo hair cells already. So it doesn't matter which manner of earness or Bluetoothness you're using, whether it's bone conduction, air conduction, you're using headphones, it's the same.
Okay.
Definitely headphones are slightly better only if you know how to control the volume. If you're using good headphones that are noise cancelling, because ukiwa kwenye noisy environment unatumia kitu kwa masikio, you tend to take the volume up so that you can hear what you're hearing. Yeah, so good noise cancellation. But also we advise people not to use those devices in noisy situations, because then you'll put the volume up.
All right.
So take care of your hearing, wear ear protection. It is really important. Noise is not the only cause of sensory neural hearing loss. Kuna vitu nyingi sana. It's just in your case is mostly noise, but tuko na viral infection. We have certain bacterial infections. We have drugs. Drugs meaning drugs that can be used to treat normal ailments. Okay, that can actually damage your hearing organ. We have trauma, accidents, kugongwa, maybe ulianguka ama uligongwa na kitu. We have genetic causes. We have age, which is the most common. So it's not just noise that can cause. And so over-the-counter medication, again, I'll also say, please do not use over-the-counter medication when you're feeling like your ears have a problem or when you're severely sick. The other thing I'll also urge Kenyans is kindly, when you feel like there's something wrong with your ears, all of a sudden you have noise, all of a sudden your ears are itching, all of a sudden there's just something not right with your ears, go to an ENT to be seen so that correct medication can be given. Kuna zile hearing loss ambazo hata kama ni sensory neural zinaweza saidika ukienda mapema.
Okay. Ukienda mapema.
Kuna zile tunaita sudden sensory neural hearing loss. Ama unfortunately ulienda mahali kulikuwa na noise kidogo kidogo hausikii. Nenda mbio kwa daktari.
Okay.
Yes.
Very important, nenda mbio kwa daktari. Na over the counter wachana na hiyo kabisa. Masuala ya masikio ni masuala sensitive sana. Nenda mbio kwa ENT uweze kusaidika. Shukran sana, Hellen. Please comment, ask the questions, engage. If you have, mimi nimejitolea sahi by the way. Engage me, all right? Alafu if you have more questions, maybe naweza kurudi tena naweza kurudi hapa.
Yes.
Maybe naweza kurudi tena hapa katika Dr. Hellen, thank you so much. Park Audiology and ENT Center. Hapa ndo mimi nimekuwa nikikuja. Asanteni sana, nashukuru.
Karibu.
For accepting hata mimi nikuja na kikosi changu hapa tufanye hino show.
It is always a pleasure.
I appreciate. Thank you so much.
Thank you so much.
Thank you for watching. This is AMTV. Mimi naitwa Alex Mwakideu, your chairman. Take care of yourself. Take care of your ears. See you on the next one.